Our vision at MVC is to enable patients in the state of Michigan to access the right care at the right cost at the right time.
Rather than focusing on a single encounter, such as a hospitalization or a surgical procedure, we provide insights into how patients are cared for before, during, and after these events. And I believe that these insights highlight opportunities to improve the quality and efficiency of care, which are a win for both the provider and the patient.
There are a number of things that make MVC unique. Our robust multi-payer data, our statewide network of hospitals and physician organizations working every day to improve the value of healthcare, and our strong partnerships with other CQIs.
MVC analytics have evolved in many ways since I joined the MVC team. One main example of that comes in our push reports. When I first joined the MVC team, we were only able to offer 2 different push reports, and now we are able to offer up to 12 different push report topics per year. We've also largely expanded the data sources that we are able to offer just outside of our general MVC data, which are claims data. We're now able to offer Medicaid data, demographic information, pharmacy data, enhanced hospital characteristic data, and we'll also begin launching our ED-based episode data very soon.
I've been involved with MVC basically since its founding, because I was being mentored by John Berkmeyer, who was the first director of the collaborative. So I've seen it grow from sort of just an idea, and where the team really was assembled just from among people in our research group, to very intentionally recruiting and hiring team members with a whole variety of expertise, very specific data analytics skills, very specific engagement and sort of hospital collaboration skills, public relations and information skills, communication skills. So really recognizing that the organization couldn't just exist with a research focus and really needed to have a improvement, promotion, communication, collaboration focus.
A lot has changed over 10 years, and it's all been pretty exciting. So some things that really come to mind is really adapting to member feedback. And so from the early years, we got a lot of very understandable feedback from members of the collaborative that they wanted to be able to learn more about the Medicare patients that we were showing them data about. And there were some restrictions on the way we could use that data initially. And in response to that feedback, we adapted by becoming a qualified entity, which was a pretty arduous process, but very much worthwhile because it allowed us to start sharing individual patient data back with the hospitals where those patients got their care.
Our team has more than doubled over the last 5 years. Much of that expansion happened in the context of COVID, when we never saw each other face to face. And despite that, we have collectively built a team that I think is an incredibly high functioning team that really understands and believes in the mission of the organization. And most importantly, really looks out for each other and works together in a really meaningful and enjoyable way. And I think our external facing accomplishments clearly wouldn't be possible were it not for the very functional and frankly outstanding team that we've been able to assemble.
The MVC projects and accomplishments that I think we were most proud of were the times when we helped to facilitate coordination and collaboration between institutions that normally would not have an opportunity to work together. For example, with the development of some of the heart failure management clinics, there were opportunities where institutions that had created novel and innovative ways of handling the care of their patients with heart failure after discharge taught other institutions what they had done and how they were successful, helped them to implement the same kinds of clinics and opportunities in their own health system. And then there was feedback to the original ones as well, where the original innovator began to adapt what they were doing based on the experiences of their other partners. And those kind of interactions among institutions that in theory are competitors was really unique, and I thought would never have happened without the collaborative to help facilitate it.
I think that we worked really hard on improving the quality of the data and making sure that people in the collaborative trusted the data. And I felt like over the years that I was the director, we saw a real increase in that trust. And then we started going more out to hospitals and meeting people face to face. And I think that direct engagement was really meaningful. And over time, it became much more about, MVC members teaching other MVC members. It wasn't about me or us in the coordinating center teaching people. It was members teaching each other.
Our hospital and physician organization members are a key strength of the Michigan Value Collaborative. It's through the collaborative learning network that sustainable improvements are able to scale and spread, and the MVC site coordinators and champions are at the heart of our network.
Thank you for your partnership.
Thank you.
Thank you for your partnership.
Thank you for your partnership.
Thank you.
Thank you for your partnership. This couldn't happen without you.